Hi, everyone, and welcome to another week in MHA621, where the topic is healthcare organizations. Um, I'm recording this at night, thus the bright lights, which I just noticed are shining off my head in a very odd way. So hopefully you're not too distracted by that. So let's keep moving into the content here. This module is going to focus on the evolution of a range of healthcare organizations with a focus on hospitals. Um, and so, and especially looking at perhaps an element of hospitals taken from another industry. And that's really the restaurant industry, which has gone through a lot of changes over the last certainly number of years, a short number of years. But let's start with that. The primary article that you have to read, and it's a long one, but I promise you a good one, is again from our friend Atul Gawande, written way back in 2012, entitled Big Med. And so in this article, Gawande focuses on not so much comparing, and I'll share a little anecdotal story about that, but looking at the efficiency in a cheesecake factory. So I'm not sure if any of you have been to the Cheesecake Factory or not. I guess it all depends on where you live and what you're, hungry for. But the efficiency associated with Cheesecake Factory and comparing that to medicine, essentially comparing it to hospitals. Now, the purpose of this article, which really became very popular back in 2012, was not to compare clinicians and doctors to cooks or managers in a Cheesecake Factory, but to look at processes, to look at the quality of the outputs from the Cheesecake Factory, which admittedly is not patients in a healthcare organization or residents in a long-term care organization, but processes that lead to a very similar and essentially identically perfect outcome, meaning whatever the dish is, whatever the cheesecake is, whatever the drink is, it is the same every time. So it doesn't matter if you're at a Cheesecake Factory in Indiana or one in Colorado. You order something and your taste, it will be the exact same quality, setup, taste, size, everything, even though they have a variety of different individuals who are working there. The chain has become, and it's a chain, as many of you know, it's become one of the most popular restaurant experiences in the United States, and not just for its signature meal. So the the article is focused on why can't medicine and healthcare mimic some of the operational changes, especially this notion of coaching. And I think all of you certainly can recognize, whether you've worked for a few months or years and years, that you have a sense of what coaching might be. I think about sports. I use a lot of sports analogies. And I think about coaching from, it doesn't matter from what age, but someone who is new to, let's say, a sport. And there's different levels of coaches, from maybe even parental coaching to more established and technically qualified coaches to potentially professional coaches. And that doesn't exist almost anywhere in healthcare. We might have mentors, we might have superiors, but we certainly don't have coaches. And what's unique about institutions like the Cheesecake Factory is there's sets of coaches that coach novice to mid-level to even experienced operators. So taking some of these strategies, employing them into healthcare organizations were really focused on improving quality. So I think about, I'm just really sharing this image to make all of you salivate, as I am doing as well. Now, we know this is a marketing, this is actually comes from the Cheesecake Factory website. This is a marketing image because everything looks pretty perfect. But that's also the goal, when essentially that everything looks perfect and looks the same. Again, the idea behind what Gawande is doing is not to compare this, but to think about tools that can be used within healthcare organizations, strategies to turn efficiency into effectiveness, to mimic and to really cut down on individual errors. And so we talk about hospitals. I'd like to talk about hospitals, as splintered organizations. Now, this was a concept that came from, I believe it was Peter Drucker, maybe long time ago. He described hospitals as splintered organizations. So you know what a splinter is? Let's say a piece of wood gets stuck in your finger, one of the most annoying things in the world, or something drops on the ground like, let's say, a glass, and it just shatters into all kinds of different pieces. Maybe those are not the same thing, but maybe go with the glass example. Lots and lots of tiny bits of glass. From a hospital perspective, this is how it runs. Lots of different pieces. Some pieces are connected close to each other. Some are not. But there's lots of different pieces within, let's say, a typical acute care hospital, which makes it one of the most complicated entities in the world. Within the same facility or close by, there's many different things that are happening at the same time. I do this on purpose because this essentially is, not that they're going in circles, but there's lots of activity happening, much of it connected, some of it never connected. And so it's very hard to, as a whole, work on organizational effectiveness when the pieces are operating. First of all, it's sort of splintered and it's operating independently, connected perhaps across circles or laterally, but as a whole, it's hard to the point of almost impossible within a hospital to effectively manage all of the different entaties into one. A little bit easier within perhaps, let's say, another type of healthcare organization, like it was certainly a physician office, not just because it's smaller than a hospital, but it's more focused. You take a dental office, even more focused as well, easier to operationalize, much harder. So what does splinteredness, I think I just made up that word, splinteredness, lead to within an organization? So we think about this notion of systemic-based errors, and I'd like you to really then focus on the NPR story that really gets into the systemic nature, systemic nature, or the system-based nature of errors in healthcare, which are extremely prevalent still today, even though long time ago, in 1999, the Institute of Medicine came up with its report, Error is Human. And certainly this is an issue of quality, is where the prediction was, on average, about 98,000 Americans die every year because of a medical error, because of, for the most part, an error that is caused within the system, as opposed to, now certainly perhaps individuals were behind that error, healthcare professionals, but it was a systemic failure that caused it. These same level of errors leading to death occur today. Now, there's been a big focus since '99 on how to, patient safety, certainly patient safety huddles as well, a great concept taken from where? Sports. I think about when I watch football, the purpose of the offensive team huddling before a play is to get together in a 4 to 5 second format to discuss the play before it's enacted. The notion of a huddle is the same thing, short, to the point, a reporting out, a discussion, and moving on. But it becomes a daily or a weekly type of event. So these are actually, the notion of huddles are still fairly new in healthcare, not just taken from sports, but taken from retail, taken from restaurants before a shift starts. These best practices come out and have been used to a point. And I think the certainly the splinteredness of healthcare deviates from that in a lot of ways. So, as I said, this is going to be a little shorter lecture here today. Let me summarize some of my thoughts. We think about, I'd like you, certainly the Big Med article should be a focus of your reading and thought process this week. Again, not to compare at all healthcare organizations to a restaurant, not to compare the individuals in each. That was not the point. Gawande was really criticized very soon after that article, and I think unfairly, because we're not comparing it. However, it also, lends itself to the notion that, are individuals who work in healthcare, non-clinical and clinical, regard what they do as a higher calling? Well, the answer should be yes. I think it is much more of a calling, even more so than a vacation, certainly more so than a job. Everything turns into a job, but it's a calling. However, there can be lessons learned from other industries. And I think manufacturing is one. Chains are another. The efficiency that comes from chains, whether it be, I don't even know if I'm spelling it, efficiency, not all, but the efficiency that comes from the operating power of change is powerful. And so using that to improve effectiveness and thus perhaps lowering errors is really the purpose here. Okay. So thanks. I'm going to stop right now. And please let me know if you have any questions. Again, I really summarized this in a very short way because I think the content pieces speak for themselves. But please feel free to let me know if you have any questions along the way. Thanks very much, folks. Bye.